Well, it's fair to say that a lot of experts talk about the science behind coronavirus, but this disease spreads through society. So here's the question then. Are we ignoring the social aspects of it? Let's explore that with ENCA's Michael Marilia, who joins me now in studio. So, Michael, you spoke to a scientist a bit earlier on who was talking to you about the social aspects of the coronavirus. What are they saying?
Yeah, so I spoke to Dr. Prof Schoub, who is a virologist, Tulis. He was actually the former head of the National Institute for Communicable Diseases, so very high up in terms of this scientific community. And I asked him about the quarantine process. So we know that a lot of countries at the epicenter of the virus, like China and Italy, have imposed mass quarantines. And I asked him whether or not that would actually work in South Africa. And he said, well, maybe, but there are some social issues here that we need to be aware of. For instance, trying to impose a quarantine in poorer communities would be particularly tricky in that a lot of people simply need to get out there and put food on the table. They don't have the luxury of being able to stay at home for long periods of time. They actually have to go out and earn a living. So it will be difficult to put a quarantine in place in that particular demographic of society. Let's very quickly listen to what he had to say about that.
Very good academic hospitals, we've got very good isolation facilities. However, in the population, we will have great problems, for example, in trying to quarantine infected individuals. At the moment, it is the more affluent individuals who are importing it from air travel. That's very easy. If it does entrench itself into the general population, that might well be a very, maybe insurmountable challenge. One that I think we have to think very, very carefully how to address it.
So Professor Schoub there mentions the facilities that we have, the hospitals that we have. Many of the hospitals in our country are in a sorry state.
Yeah.
And then it raises the question then of if we were to see a wave of coronavirus cases, would they be able to handle that?
Yeah, that's a good question. It seems that he's worried about the capacity. So an influx of patients with coronavirus in our hospitals. He's wondering whether or not we do actually have the capacity and perhaps the hospital beds with which to take care of them, Tulis, which seems to be an ongoing concern in South Africa. This is an issue that's also been raised in the United States, by the way, the number of hospital beds that they actually have for patients who might contract the virus. He says, you know, we need to take a leaf out of the Chinese book where they managed to build those temporary hospitals in a matter of weeks and set up and capacitate themselves. Let's quickly listen to what he had to say.
If there's an extensive outbreak in the country, we will be in trouble. I think we need to, how resourceful we can be. You know, if you take the other extreme in China, they built 2 hospitals in 2 weeks. I'm not sure we could do that, but certainly makeshift hospitals, temporary hospitals, which can isolate perhaps the not so ill individuals, people that are moderately but not severely ill. We may be able to respond to that, but that is a worry, that will we have enough public health facilities to cater for if there's a very significant outbreak.
So, Michael, the private health sector in this country is huge. It's massive. And a lot of people, you know, bear the costs of private medical care on a monthly basis. But large communities, especially the poor, still rely on the public sector. What are the other dangers that come out from when you talk specifically about poorer communities?
Well, quite surprising. I mean, we went in there this morning when we did the interview talking about the science and the big picture. And the professor raising an important point. He said that clean water is a crucial part of this campaign. People actually need clean water in order to wash their hands, Tulis, because we keep hearing the scientists saying hygiene is important, you have to wash your hands, you have to make sure that aspect is taken care of. But he raised the question of, well, do our communities have clean water? Many of them don't. In some parts of the country, that is an issue. Access to water is a problem. And he's flagged that as a concern as we brace for more cases in South Africa. Let's take a listen to that bite.
Washing is such a critical component in infection prevention and control. But for hand washing, you need water. You need adequate water. You need clean water. You need soap. You need preferably disposable towels. Now, all these things, of course, are not available in much of the population.
So as you were saying that, I was just thinking about videos that we keep seeing from Madibeng local municipality, where residents are so frustrated and they keep taking these videos where they open the taps for water and it's just brown liquid stuff coming out. Imagine now being told to wash your hands. What do you do?
Yep.
Wash your hands with what?
Absolutely, and of course you have the spectre of a deadly virus hanging over your head. So both the social and the science very much front and centre at the moment.
Michael, thank you for that update. Michael Marili has been watching that angle for us. I mean, it really is a concern. This is what happens when we neglect certain of our obligations in our society. Many of these communities will now be found wanting because they simply don't have the water they are supposed to have. And much of it, yes, it's natural in terms of climate change and drought, but a lot of it is self-created, self-inflicted. Think about Kwakwa, for example. A lot of what happens there is self-inflicted.